Welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining us again this week.
Hi, good afternoon.
Good afternoon. My name is Dilshad Burman, and I am a writer and reporter with City and CityNews, and I will be moderating this chat today. So the way it works is we have been collecting your questions over the past few days for the doctor, and we will present them to her today. She's never seen them before. If you haven't had a chance to submit your questions yet, that's no problem. You can still do so under this live broadcast, and we're going to try to get to as many of your questions as we can in this short 30-minute period that we have with the doctor today. So we're going to start with our submitted questions, but if you don't hear your question answered, feel free to pop in and let us know, and we will ask your question. Doctor, are you ready to go?
Yeah, let's go.
Okay, wonderful. So let's get started with, as I said, the submitted questions that we have here. We're going to start with a set of vaccine questions that we've been collecting because that's top of mind for everybody, and then we'll move on to the other non-vaccine related questions. Starting with Dan. Dan asks, can a hemophilic person or person who is allergic to painkillers take a COVID-19 vaccine shot?
Yes, absolutely. So if you have hemophilia, it means that your blood you might bleed a little bit more if you get a vaccine. So all it means is that you're going to have to put more pressure on the vaccine site. If you have the type of hemophilia where you need to get treatment before you get a vaccine, well, then that would be just fine as well too. And even if you're on medications, including painkillers, the vaccine is still safe. Yeah.
Okay. And then Joseph asks, are international students eligible for vaccination in Ontario?
Yes, so anyone in Ontario, if they have OHIP, no OHIP, as long as they are here, they have an address for being here, they are eligible for vaccination. So someone who may be an international student doesn't have an OHIP card, yes, they can either get a vaccine through a hospital if they're eligible through one of the hospital or pop-up clinics, or they can call the Toronto Public Health Hotline or some other community agencies who can arrange for you to get a login so that you could book an online appointment.
Okay, that makes sense. And then, already we've got some live questions coming in. So let's take this one. We've actually got several questions about the gap between the two shots. So Shalini asks, will the gap between the two shots for our second dose be reduced for all of us?
So it's a good question. I can say that the recommendation from the National Advisory Committee on Immunization to extend that second dose was because of vaccine supply shortages. Right. And so now as we're getting more vaccine, I don't know what the vaccine horizon is, but we can wait to hear from the provincial government on, how much vaccine we have and whether more groups can have that shortened dose. There certainly are some groups that are eligible based on medical conditions or healthcare workers who work directly with COVID patients. But for everyone, we'll have to wait to hear from the provincial government on that.
Right, absolutely. And let's go back to a couple of our submitted questions here. Shailendra, who is a regular contributor to our Q&As, asks, if someone has COVID-19 and has mild or moderate symptoms and is staying home, should that individual be receiving a blood thinner such as heparin injections or aspirin?
So I'm not an expert on treatment of COVID-19, but if you have a mild illness such that you're able to manage at home, you're not having breathing problems, well, then you just treat your symptoms with over-the-counter type medications. Right. There's no recommendation right now for those individuals to be on blood thinners.
Okay. And then let's see, we've got some live questions coming in again. Andrew asks, how many adverse reactions have been seen in Canadian patients? I'm assuming adverse reactions to the vaccine.
Okay, well, Andrew, you can actually go online. The Public Health Agency of Canada publishes this data every Friday. Mm-hmm. So every report that has been made is then reported provincially and then reported federally. It's important to note that the reports look at, what are the reactions that are being reported. And if there's one that is out of proportion to what you would expect, then it looks for safety signals. And so they post that every Friday on their website.
Okay, wonderful. So that data is available widely, or rather readily. Okay, let's go to another question here. Anonymous asks, how will it work if the province starts mixing vaccine doses, given that Pfizer and Moderna are mRNA vaccines and AstraZeneca is not?
Yeah, we're going to have to wait to see what the recommendations are that come out. Some of it is going to depend on what vaccines do we have in supply. Like right now, it's the Pfizer and Moderna vaccine that we have.
Yes.
We don't have the other two vaccines to offer, or they're not being offered. And so the recommendation will come. There will be one from the National Advisory Committee on Immunization, and then provinces will decide what to do. But the trial in the UK had 4 groups. One was Pfizer, AstraZeneca. Pfizer first, then AstraZeneca, or AstraZeneca first and then Pfizer. And so they released the results from that study that showed that actually it's safe. You can actually, if you have a mixed schedule, you might have a bit more of a sore arm or a fever, feel unwell, but within the same range of what we had seen, no other side effects reported. And now we're waiting to get the results on, well, how well do those mixed schedules work?
Right, absolutely. And then speaking of side effects, Linda, it's more of a comment, but I'm assuming she's asking what can be done about this. Linda asks, I had many symptoms for over 3 weeks from the Moderna shot. Is that normal? What should she do?
Yeah, I guess it depends on the symptoms. And I think what you should do is follow up with your doctor or nurse practitioner to see them, to see if it's expected. A report can be made to have that reported to public health. What we know with Moderna is sometimes actually a week after you get the vaccine, you can get this a very sore arm, swollen arm. It's not an infection. It will go away, but it is related to the vaccination. We also know with the Moderna vaccine, you can get more lymph gland swelling under the arms. So those two are more specific to Moderna compared to Pfizer. Again, if the side effects last longer than expected or they're severe, those are signs that you should see your doctor to get it reported. Yes.
Right, absolutely. And then, doctor, you were talking about the reporting process. The doctor collects your report and then that goes up higher, right? Like it's in a registry or it's in some sort of list that we're compiling.
Yeah, so it gets reported actually to local public health. So if you live in Toronto, it will be reported to Toronto Public Health. And we have a team that investigates these. So you may actually get a call from Toronto Public Health collecting more information. Some of the reports we report up, like there's specific reporting criteria. If it's, sore arm lasted for 2 days, we don't report those ones that are expected. You expect to get a sore arm for a few days. It's the more severe ones, symptoms that last for longer, ones that are unexpected. They then get reported to the province. The province then reports it to the Public Health Agency of Canada.
Right. Okay. And then more vaccine questions coming in here. T asks, I am pregnant and due in August. My second dose is scheduled near my due date. Am I eligible to get the second dose earlier than my due date to ensure safety during delivery?
So good question. Right now, you're eligible to get vaccinated during pregnancy, but pregnancy is not one of those conditions that allows you to have a shortened second dose. Now, more to come on that. Again, if in the summer we have tons more vaccine, we might be able to shorten that interval for others, including perhaps yourself.
Right. Okay. And then Ashley asks, here's another live question. If my family is fully vaccinated, but my toddler still isn't able to do so because of guidelines, obviously children are not eligible yet, should we still hold back from putting them into group children activities such as gymnastics or soccer?
Yeah, so right now those activities are not allowed, they're not open, but yeah, those are good questions. That's the kind of stuff that as we have more people, even though the toddlers won't be vaccinated, but if more people in the fall have 2 doses of vaccine, the Public Health Agency of Canada has kind of given us a blueprint and said, well, in that situation, we can have more indoor activities, so we can have more indoor sports, for example. So yes, that is something that may be coming. It's not here right now. And so we're going to have to wait to see. The other thing that's going to have to happen is our numbers of COVID cases are going to have to really go down. Yes. But that is expected. I mean, that's what we're hoping for.
Right. Yeah. Fingers crossed, of course. And then let's move on. Some more submitted questions here from over the past week. Shannon asks, I got my AstraZeneca vaccine and I know that there are doses that we have in stock that are set to expire. I want to get my second dose ASAP. If people do not want it, why can I not make the choice and get my second shot now?
Yeah, so that is a provincial decision. I work at the local public health level. That is a decision that was made provincially to pause those vaccinations. So we're going to have to wait to hear from them on what to do, and what may be coming.
Yeah, absolutely. Those are provincial directions. Okay, we'll take a quick sidebar from vaccine questions right now because we have a few others coming in. Let's take these. Fatiha asks, is there any chance that schools will open on June 2nd?
I think there's always a chance that schools can open. Yes. I mean, we have said from a public health perspective, schools should be the first to open before you open other sectors of the economy, the recovery, the society, that schools should open first. Now, a lot of it is going to depend on our COVID numbers. They're coming down, but they are still high. And so I think, nothing has been written off yet. And we recognize how important it is for kids to be in school. It is that balancing act, though, at looking at the rates of COVID and safely reopening.
Right. Excuse me. And then a related question to schools, Marlena asks, will masks still be required for in-person school, even though most children 12 and over will be vaccinated come September?
Yeah, I mean, there's a lot of things come September that we're just not sure about. What about physical distancing? What about wearing masks? What about screening? I mean, there's a lot of things that we do right now that we can potentially change, maybe not all of them, but maybe some of them when we have more people vaccinated. And we've started to see that already in Ontario, like we're seeing in long-term care homes. A resident is vaccinated, their essential caregiver is vaccinated. They can meet now together, right? So there are changes coming. They will come for sure, but we just don't have those details right now.
Right. And of course, September is a lifetime away when it comes to COVID timelines. So lots more to come, I'm sure. And then this is something I'm not familiar with, so I'll ask it though. Justin asks, can you please explain SM-102?
I'm not sure what that is either. Yeah.
For sure. Justin, if you'd like to explain a little bit more, we'll try and ask your question again to the doctor so we have a little more clarity on that. Let's go back to our submitted questions now. Noodles and Nancy have a similar question. So basically, they both had side effects from the first shot of AstraZeneca, and they don't want to get the second shot of AstraZeneca. How do they go about getting Pfizer if their age group was targeted for AstraZeneca specifically?
Yeah. So again, there's a lot of people who got the first dose of AstraZeneca and want the second dose of AstraZeneca. There are also people who got the first dose of AstraZeneca and don't want it. There's a lot of different opinions out there for people who have got AstraZeneca. I mean, the bottom line, I do want to say, it was a good choice. It is a very good vaccine. Mm-hmm. We don't have a lot of it right now. So that's part of, the decision making. And so we will have more guidance when those second doses are available for what your choices are, if there are any, what vaccine you should get, what vaccines we have. So there will be more coming out on that.
Right. And then this person's alias is truly concerned. Why is Canada the only country that is waiting so long between the first and the second dose?
Actually, we're not the only country that has had an extended dose interval. The UK has done it as well, too. The only reason why we did it in Canada was for one reason only, and that's because of vaccine supply. It's because we had vaccine shortages. And you see, now we're in a place where, in my own city in Toronto, we can say that 60% of adults are vaccinated, and, we still have more to vaccinate. We would not be in this place right now if we were still giving second doses in that shortened interval. Mm-hmm. And by vaccinating more people, it has allowed us to get to that community immunity, that herd immunity protection, which is so important when we're in the midst of such high numbers from a third wave. Right. The other thing to note is, there was a study that was released that showed that an extended interval may actually be helpful, so that second dose gives you a stronger booster immune response.
Right.
And so what is that ideal gap? I think that question was asked once on this show. You know, is it really 1 month? Is it 2 months? Is it 6 weeks, 8 weeks? I mean, no studies have done to show that, but sometimes a bit more of a gap between the first and second dose gives that second dose a stronger response. And we know that for sure for AstraZeneca, because they actually did the study. That second dose
Right.
at 12 weeks, it gives you a better response than at 1 month.
Yes, absolutely. Okay, and then Anne asks, again, it's about the interval because a lot of people are concerned, especially when they have certain conditions. Anne says, I received my first dose of Pfizer and I have to wait for an email to know when I'm going to get my second one booked. How will I know the date for my second dose, and when can can I change it? Anne says they have diabetes and will be at more serious risk if they actually get the illness. And waiting 16 weeks for the second dose will put her at very high risk. It's vitally important that she gets the vaccine within 6 weeks. What will be the support for people with very high risk? How can I book the second dose earlier?
Okay, so actually we know from early data in Ontario that first dose, including for elderly, including for those who have conditions, was 70% effective. And the CDC had a similar study that showed one dose was 80% effective for those messenger RNA vaccines. So that is very good protection. That second dose, if you don't have one booked, it will be given at, the latest at that 4-month interval. It will not be given beyond that. And so wherever you got the vaccine, they are committed. The understanding is that they will be in touch with you for that second dose. It won't be longer than 4 months. If it will be shorter, it will depend again on vaccine supply and some of those logistics. And so more to come on that.
Okay. And then, Doctor, we just covered why Canada has such a large gap between the first and second shots, but Elle has an addendum to that question. Why has Canada opted to do so, and is the efficacy the same when you wait so long?
There's no question that 2 doses gives you, in the long run, that better protection, and so we definitely still need to get that second dose. But what we know is that first dose gives you very strong protection, and by vaccinating more people with single doses, when we have vaccine shortages, it actually reduces the number of deaths. So you can have 10% fewer deaths, and so that's another reason why this strategy was taken. But definitely, the plan is to get a second dose, to get, again, that boosted protection, probably longer term protection, and the higher protection.
Right. And sorry, in terms of efficacy, because most people are saying, manufacturer says it's 3 weeks. If you wait 4 months, is it still going to give you that same protection? Will it be as effective?
Yes, so the studies are showing that, again, one dose 70 to 80%, 2 doses 90+%. And even the early Ontario data shows that 2 doses gives you, around that 90% protection for those who have had it. Yeah.
Okay. And then Momo asks, will my daughter studying in Italy be able to get both shots before returning to university in that country?
I can't speak for Italy. I mean, if your daughter lives here and is here, they will be eligible here. Will they get a shortened interval because they're traveling? There's no, that is not one of the criteria for getting a shortened interval yet, unfortunately. Yeah.
Right. And Jess asks, I'm getting married in October this year, 30 guests total in a restaurant. Some of my guests, including my maid of honor, aren't planning to get the vaccine. My mom has COPD and my future in-laws family has high-risk medical issues as well. Would it be safe to allow non-vaccinated people to attend my wedding?
These are complicated questions, aren't they? I think it's hard to know in October what we're going to allow. I mean, I really hope that you can have a wedding, either indoor or outdoor, in October. I think the one thing I could say is, yes, absolutely, having your guests vaccinated, 2 doses will be good, provide better protection. I mean, the other options are, an outdoor wedding is going to be a lot safer than an indoor wedding, for example. Having everyone wear masks is going to provide additional protection, keeping that physical distance. So, all of the things that we have been doing, making sure that if people are sick, they don't attend, having a virtual option maybe for those who are high at risk. Like, I think we still need to continue some of those things. We're not going to throw everything away, especially not at once until we know that it's safe. And so I think these are the things that we can put in place when when there are groups of people who are unvaccinated and we want to lower the risks.
Right, absolutely. And then we've got another live question coming in here. Mona asks, is it true that the COVID vaccine will be required yearly now? I guess like the flu vaccine.
No, that hasn't been decided, actually. So, I mean, we may need a booster dose, so if there's a new variant for which the vaccine that we had is not providing protection, or if somehow the protection that we have goes away by a year or so, then a booster dose is something that can occur, but it's certainly not something that, has been decided on, that there's a need for that yet.
Okay. And then, this is interesting. Elena asks, does your immune system struggle a bit while menstruating? So for people who will be menstruating during their vaccine appointment, for example, will the vaccine strain their immune system too much? And how often will those people experience more severe side effects?
Okay, so as far as I know, as a medical doctor, there is no connection between menstruating and weakened immune system. And there certainly is no recommendation that if you're menstruating, you can't be vaccinated. There have been no links between getting the vaccine and menstrual irregularities.
Right.
So, as long as you don't have symptoms of COVID, because we don't want to potentially spread COVID,
yes.
Whatever other symptoms that you have, that are not severe, that are expected, you could still, like menstruating, whether you would call that a symptom or not, but you could still get vaccinated. That would be just fine.
Right. Absolutely. Okay. Dina asks, my parents are in Toronto as visitors and unable to travel back due to flight restrictions. If they take one dose of the vaccine here, but that same vaccine is not available in their country when they travel in a month or two, what is the recommendation in this case? What shall they do?
So the general recommendation is to get a second dose of another vaccine. That is the current recommendation, that if the vaccine that you got for your first dose is unavailable, that you could just get a second dose of another vaccine.
Okay. Robert asks, I got my first shot 3 weeks ago of AstraZeneca. If they're offering a second dose of this same drug, is it safe to get it?
Yeah, so Robert, I think we're kind of waiting to hear whether we're going to be providing second doses. When we provided the first doses, it was based on that benefit risk ratio, and it was looking at, well, how much COVID is spreading, which vaccines do we have available? We didn't have a lot of vaccines available. What's the age range? And trying to look at that benefit risk assessment. And so those are the kind of things that will have to be balanced kind of on a provincial level when they make the recommendation about second doses. It seems right now that the second dose, the risks for that rare clotting, blood clot disorder may be much lower, maybe 1 in a million. It's hard to say definitively right now, but if that's the case, then again, the risks are lower. So again, that all has to be put into that benefit risk assessment. Yeah.
Right. And we're still waiting on that for sure.
That's right. Yeah.
And so Jude asks another live question coming in here. I want to mix my vaccine doses. Do I have that choice? And if so, how do I go about it?
So right now, it's not a choice. Like right now, what you had for your first dose, we're going to try and give you that for your second dose, except, so when it comes to Pfizer and Moderna, that's the situation. When it comes to AstraZeneca, the second doses are paused right now with AstraZeneca. So again, with these mixed schedules, there will be more coming out, I hope in the next few weeks.
Yeah, absolutely. Because it just happened. They just paused it, and there's so much more to sort of, I guess, study and work out, right? Even logistically. So, okay. So Jude just said the addition to that question is that they got their AstraZeneca vaccine over 3 months ago. So I guess their second dose is coming up. So that's
it's coming up. Yeah. So the hope is that there's a recommendation before the second doses are due. In June. Yeah.
Right. Absolutely. Okay, Mary asks, is restarting the whole vaccine process, like getting the first and second doses of mRNA, an option after taking the first shot of AstraZeneca? So, and also how long do we need to wait after receiving that first shot of AstraZeneca to be eligible to take the mRNA vaccine series?
Yeah, so I actually, it looks like you're not going to need to restart the series, and it may just be that one dose of AstraZeneca and one dose Pfizer is considered a complete series. Right. I mean, we have mixed vaccines before. If you're getting the measles, mumps, rubella vaccine, we don't look at the brand. It's a measles, mumps, rubella vaccine. The second dose is a measles, mumps, rubella vaccine, regardless of who the manufacturer is. Right. So that's not uncommon in vaccines, especially when they work very similarly. All of the vaccines work with, the instructions for a spike protein to which you make antibodies. Mm-hmm. And so, as long as that second dose, whatever the brand, gives you that booster response to give you that immunity, well then, restarting the series, starting a new series, a third dose is not necessary. Mm-hmm. But I can't say that definitively right now. Again, we're just waiting for more, but it's not likely to be that you're going to abandon that first dose and start a new series.
Start new. Okay. Another live question coming in here from Maria. Maria asks, for a breastfeeding woman, is the vaccine safe?
Yes, so the vaccine is safe with breastfeeding, absolutely. We know that the vaccine doesn't pass through the milk. So it actually is in your body and actually is out of your body within a few days, actually. But then your body makes the antibodies. And we know breast milk actually can be quite full of antibodies, which is good for the baby, and including these antibodies made from the vaccine.
Right. And then Kat asks, there are also reports I have seen about a rare nerve disorder with AstraZeneca shots. Do you have any additional information on that, please?
Yeah, so there has been, people can get nerve disorders like Guillain-Barré, like Bell's palsy. These things do occur whether we're vaccinating or not vaccinating. And when we vaccinate 1.4 billion people around the world, people are going to have nerve disorders following vaccination. Yeah. What we want to know is, did the vaccination cause the nerve disorder? And when we vaccinate millions of people, if there is an association, if the vaccine causes something like a nerve disorder, we should see the rates of that nerve disorder go up. They should be much higher. Yes. And that's how we detected that rare blood clot for AstraZeneca, because people were getting it after vaccination, and there were so many more of them than what you would expect. Mm-hmm. And so in terms of nerve disorders for any of the vaccines, none of them have been identified as being more at risk because of vaccination, but it is something that is actively being monitored to make sure that the rates of those nerve disorders are not going up and that they're not associated with the vaccine. So that is ongoing, but right now there has been, we call them safety signals, but there has been no connection made.
Okay. And then this is the last vaccine question for a little bit, unless we get some live ones. Dan asks, is it safe to assume that any tests that are positive for COVID now are from individuals that have not taken the vaccine?
Well, it is still possible that if you're vaccinated, you could get COVID and that you could test positive. And that has certainly been the case. I mean, we know the vaccines are not 100%. They work very, very good. And the goal of vaccination is to keep you out of hospital and dying from COVID. So it is a smaller chance. There is still a chance, though, that you could get COVID. And especially now, because we have so much COVID still circulating, even if you're vaccinated, you really have to take precautions because you could get COVID. So I think that being said, many of the people who are vaccinated and get COVID get a milder illness. They don't end up in hospital. Yes. And overall, we know from early data in Ontario, out of 3.5 million people who were vaccinated, only 0.06% got COVID. So it is quite small.
That's quite encouraging. Yeah, absolutely. We have a couple of minutes left. I'm going to try and get to some live questions. Fred asks, will vaccinated folks be able to give blood, and will this contaminate the blood supply?
So I'm not an expert in the Canadian Blood Service. I have not heard, though, that they would make restrictions based on vaccinations. Mm-hmm. If you're vaccinated, it means that you have antibodies in your blood, and those antibodies actually could be protective for somebody else, actually, who may, in an emergency, need COVID. But that's not why you're giving blood, to give your antibodies. Right. As far as I know, there are no limitations on being vaccinated and being able to provide blood.
Okay, and then one last live question, and I'll let you go, doctor. It's almost 1 o'clock. Linda asks, can a doctor in an LTC home who is fully vaccinated just test positive for COVID?
So it is rare. Again, if you've had 2 doses of the vaccine, for you to test positive, it would be rare. Sometimes you can test positive and it's a false positive. That does occur as well, too. The other thing to note is if it's a variant. So some variants give you less protection, from the vaccine, enough to keep you out of hospital, but you could still potentially get, a respiratory infection. So those are 2 possible explanations that could be occurring.
Right, absolutely. And that brings us to 1 o'clock. Doctor, thank you so much for taking the time and patiently answering all these questions. Thank you to everybody that submitted live and submitted over the past week as well. We will have the doctor back with us next week once again, so you can ask her all your questions then. Thank you so much, doctor.
Okay, bye-bye.
Bye-bye, everyone.